I kind of had to hit rock bottom with that. I mean, I become very isolated from my kids and my husband in some ways, a lot of time in bed, being sad. When I started to invest time and energy in my mental health and like what I needed to feel good, I gained a new agency and control in my life because when you have chronic pain, you feel like you have no control. I feel you can feel very helpless. And so that's the main message, I think. It's looking inward. And when you talk about
Hey, hello everybody. Welcome to this channel, and I'm so excited to bring here a expert from the United States. She is Mara Baer, and she's an expert in health policy. So this is amazing. She's also an expert in pain because she lives with chronic pain. So this interview is going to be amazing. And Mara is the founder and president of Ago Health, that she will explain to you, a healthcare policy consulting firm dedicated to helping organizations navigate the complexities of today's healthcare policy environment. So that's not easy. And she leveraged her policy expertise to advocate for policy change to improve the care and lives of people with lived experiences of chronic pain. And she is the right person to do this because she lives with chronic pain for over 10 years and is diagnosed with thoracic outlet syndrome, or TOS. So thank you, Mara. Welcome to this channel. And we'd love to hear from you. Why don't you start telling us about your experience with chronic pain, what happened, and your journey, especially from a lens of someone who comes from, an expert in health policy. So can you tell us your story?
Sure. And thank you so much for having me. It's great to be here. And I just so appreciate the work that you do to elevate this important issue. So, yes, I've worked in healthcare and healthcare policy for over 20 years. And when I lived in Washington, D.C., I had on and off issues with chronic pain. I had problems with carpal tunnel or low back pain, and it was sort of intermittent. And I found strategies through physical therapy or other interventions to kind of address those issues. But when I moved to Colorado in 2014, my problems became much more persistent and continuous. And it was within 6 months of moving to Colorado that my periodic pain became constant pain. And over the course of perhaps a year, it was determined that I had thoracic outlet syndrome. For those of you that don't know about that condition, it is a nerve entrapment issue that is commonly in the thoracic spine area. And for some people, it is a product of having extra cervical ribs in the neck area, which I found out I had. And it was causing impingement in my neck and referred pain down my neck, shoulder, arm, and hand. And that became a constant issue for me. And I'm sure we'll get into the details about sort of my mental health experience with this. But what I would say is that over the course of those first few years of pursuing medical treatments, my mental health really suffered as a result. And even though I work in healthcare policy and I understand the dynamics around how the healthcare systems operate, I was really blind to what was happening with my mental health as a result of this sort of persistent problem that continued over many, many years. And I can get more into the details if you want about sort of when my wake-up call happened and how I started to tackle that, but I'll pause there and see if there's any questions or specifics you want to ask me.
Yeah, so I would like to explain to our audience who are not familiar with thoracic outlet syndrome that this is a nerve compression in the nerves that come from the neck and innervate our arm. So all we call those nerve roots from the neck, they have to pass below the collarbone here in our neck and go to the shoulder and arm. And as she said, some people are born with an extra rib. We call that cervical rib. We're supposed to have 12, but she was born with 13. So then that extra rib occupies the space below the collarbone here and then compress the nerves. And this is a kind of neuropathic pain. So for those of you who watch my channel and I talk about the three mechanisms of pain, nociceptive, neuropathic, nociplastic, this is very neuropathic pain. So yeah, I have a question for you. Did you need surgery to remove this extra rib that you had and both sides?
Yeah, so that's a very good and interesting question, and it's very much related to sort of the complexities of my journey and my mental health. So in the beginning, I tried many modes of treatment, from medications to physical therapy, alternative surgeries that are less invasive than that surgery, because the outcomes associated with that surgery are very mixed. And so it was about 8 years, 7, 8 years of me trying other types of modalities to address the problem before I did have surgery to remove not only the, as I would consider an abnormal rib, and my first rib in the cervical spine. And it's a very complex surgery. It involved a 4-night hospital stay and over a year of sort of recovery, although I would argue that the surgery did not prove effective. And that despite the fact that the ribs were removed, what one would consider as the source of the pain, I continue to have pain 4 years since the surgery. So I had the surgery in 2021. And so that experience of having a failed surgery after a very intense recovery was pretty devastating to my mental health and really got me on this path to start to understand the biopsychosocial nature of pain and how involved our mental health and our environment are in this journey. So it was really hard to go through. That was my third surgery for this condition. I had had a surgery in 2017 and one in 2019 to try to address kind of downstream pain. I had had a ulnar nerve and a carpal tunnel release done, and neither of those provided a lot of relief. I got a little bit of relief from those other surgeries. I had hand numbness that kind of dissipated as a result, but the underlying problem continued. I would say, and I know we're going to talk about the mental health side, I would say that during this time of all this happening, I had just moved to Colorado. I had a 2 and a 4-year-old when this started. I was trying to launch my consulting business. So I had a lot of stress and change happening in my life. And when I look back now, I think I realized that some of what I was experiencing was probably exacerbated by conditions of my environment. There are many people that have extra ribs in their cervical spine that never have pain. So we know some people will experience pain and some won't. And I think, that's where this idea of the complex nature of pain and biopsychosocial nature of pain come into play.
Yes. Oh, this is so important. And I love that you touched on the biopsychosocial nature of pain, because that's the definition of pain. It's a part, it's not just a biomedical thing. And sometimes I have difficulty to explain to my patients what I mean by biopsychosocial. And even to my colleagues who are in the medical field, they see pain mostly as a biological thing, a biomedical thing that needs to be eliminated. And once you eliminate the cause of that pain, the pain will go away. But as you mentioned, you explained this so well that you removed the rib and the pain didn't go away. And there are people who have an extra rib and they don't have pain. So that's all the complexity. I think I would ask you to explain what do you mean by this biopsychosocial aspect of pain? What is the social aspect of pain? And what is the psycho? Because bio, I think we all understand what's bio. If something is broken, you need to fix and the pain will go away. But in your case, what was the psycho and the social aspect? and how that influences pain. We know that influences the intensity of pain, can also prolong pain. How did you experience that, and how do you explain this to your colleagues? Because I think you explain so well.
Yes, I think, what I would say is, so I have a background in social work in addition to healthcare policy. And, one would think that someone with my background over many, many years would recognize that, my mental health was really failing as my physical health was failing. And it took me a really long time to understand these connections. Part of the problem was that my clinicians, to your point, were not talking to me about mental health and how what's happening in your environment and in your psychological sort of framing, it has an influence. And so, I tell the story of how after this failed surgery, I'm, sort of 7 years in, 8 years in, I've lost count by now. It's been a lot of years. I went to see a new doctor who I really liked, and I was in my first appointment with her, and she was the first doctor to ask me after all those years, how do you feel about this journey and your pain, and how are you feeling about all this? And I had never had a doctor ask me that, and it was sort of shocking. And she followed it by saying, Mara, you might always live with pain and never feel fully better. And medicine is actually pretty awful at treating pain because it's so complicated and so dynamic. And when she said that to me, it really struck me and hit me as like, wow, I might live like this forever. And what am I going to do about this? And number one, it struck me as medicine is not really focused on the fact that the biopsychosocial nature of pain is about three things, as you say. One is our environment and how we're reacting to our environment. That's sort of the social, emotional side of our experience. And then psychologically, how are we interpreting our pain experience, and how are we reacting to it and adapting to it, and how do we live a life with it? And what messages are we or others sending us? And so when I think about her words, that was when I decided I needed mental health support to try to understand the psychosocial part of my experience. And there's a lot of data out there around how significant the psychosocial elements of pain are, to your point. So what we know is that the 4 to 5 times people who live with chronic pain are 4 to 5 times more likely to have depression and anxiety than those without, and that those experiences are bidirectional with pain. So obviously, if you have pain, you probably are more likely to have depression, anxiety. But the data says that depression, anxiety actually feeds chronic pain and can make chronic pain worse. And so people get in this vicious cycle. And that's why what we're doing in our environment, how we're experiencing our environment, how we're experiencing our history, what stressors we have, how we cope with those stressors in life are very integrated into the pain experience. And so I do write about that quite a bit. I've experienced it directly. And when I finally started to see a pain psychologist to help me interpret and understand, I learned that a lot of what was going on with me was far beyond just my pain experience. It was deeply seated in relationships, history, including history of trauma, which, as the research shows, many people who've experienced trauma in childhood are much more susceptible to experiencing pain as adults. And so all of these things showed up for me in therapy and became a big part of my learning and healing and how to live a good life despite pain, and doing the things that I need to do for my social emotional health, so that my pain can become less dominant in driving how I live my life. So I'm
Yeah,
not sure if that totally answers your question, but I feel like I kind of
It
it moves to the
does.
point. Yeah.
Yes, of course it does. And you were touching on a lot of points that I even mentioned in my book, my first book, The 8 Steps to Conquer Chronic Pain. Basically, the 8 steps is, you know, the first one is retraining your pain system, knowing when you can release your endorphins. But the second one is control your emotions. So I consider you a conqueror of chronic pain because you have walked those steps, like basically, the steps here, taking care of your sleep, exercising, your relationships. So that's what I mean when I say someone can conquer their chronic pain. It doesn't mean that the pain will be eliminated. Sometimes it can be eliminated. That's good. But when it's not, how can you live your life well? And you're here showing us that it's possible by looking at the individual as a whole. This is so important. Thank you so much for illustrating those concepts so well. And I think people can understand now that all of these emotional relationships, the baggage that you bring from your childhood, your hopes for the future, if you're anger, frustrated because you're losing something because of pain, it could be anger at the healthcare system that did not diagnose you, 10 years ago, and you lost 10 years of your life. So there are so many things going on in our mind. And I tell people we can't separate the mind from the body. They are connected. And pain is a construct of our brain. Our brain is the one that interprets, gives meaning, and the intensity of pain can fluctuate depending on not only how intense is that inflammation in your joint. Sometimes this has very little influence on how much pain you feel on that scale from 0 to 10. Very little. I've seen people who have a severe injury in front of me. They're a lot of things are damaged. And they say, I'm okay, my pain is not so bad. And then I have people who I can't find any damage to the body and they're screaming. They're saying my pain is 10 out of 10. Most of the intensity of pain, I would say, comes from those psychosocial aspects. So, Mara, I would like to change gears a little bit and ask you, what do you think is needed from, doctors like me? I'm a pain specialist. I only see people with chronic pain, but doctors in general who are not specialists, or maybe those who are specialists in pain, what do you think the healthcare system needs from the medical field, from the allied health professionals, because they also contribute a lot to our patients who have pain, the nursing systems, the rehabilitation professionals who are, they're much more present in our society than physicians. Like it's much easier for you to find quickly a physiotherapist, a chiropractor, a kinesiologist than maybe have an appointment with a doctor, at least here in Canada. And so what the healthcare system needs, and I know you live in the United States, I live in Canada, we have different healthcare systems, and but for someone in general, irrespective where they live in the world, we have audience who are living in Asia, South America, Europe. Let's say that you had a magic wand and you could fix the healthcare system for people living with chronic pain, no matter where they live, what would you do? What would be your recommendations?
Yeah, I love that question. And wow, would we all like to have a magic wand most days? That would be lovely. Um, so I think it starts with the education system for clinicians, right? And I can't speak to other countries and how much education they get on the pain and the biopsychosocial nature of pain, broadly across the world. But I can say in the US, individuals going through medical school here get less than 3% of their total education on pain generally. And considering most people go to the doctor for pain, it feels not very right-sized. And I would assume that in most countries, pain is not like a dominant thing taught in medicine, but it's such a big part of treatment and the needs that people bring. And so I think it starts with improving education around pain in medical school, and making sure that this well-researched, well-documented evidence around the biopsychosocial nature of pain is really foundational to the teaching. And that would be sort of my first wish with my wand. Um, and I'd say that the other something I observe here, and I'd be curious if this is a challenge in Canada and what you know about other countries, is that we still in our country have a very bifurcated healthcare system where mental health is so siloed still from physical health. And in our country, we have a lot of efforts to try to bring these things closer together, but we're really far off from doing the best job we can. And if mental health is under the same roof as the pain center, it's much easier to connect those dots for patients. And if clinicians are taught to understand the biopsychosocial nature of pain and learn tactics and strategies to address it, including getting to the right clinical mental health professionals, I think we can move a long way. I personally, in my experience, have felt that my clinicians, and I've heard this in some of the research I do as well, they're afraid to open the psychosocial box because as a clinician, you might not have the tools or the resources to get the patient to the right place. And if we can build systems so that these things are closer together and that doctors don't feel afraid to open the mental health box, people are going to be served much better. And I most certainly, I have a story I tell about how an academic medical institution here in Colorado, very large health system that has a pain center, was treating me pre-surgery during COVID. I was waiting for a COVID vaccine to have my surgery, and I was getting injections. And I reached out to them and said, I'm struggling with my mental health related to my pain. I need help. And they said, you need to call your primary care doctor. We can't help you. And this is a major healthcare academic institution. And I learned later through some of the work I do that the reason that was how I was directed was because the systems in this big institution did not give the pain center resources for this purpose, for supporting psychosocial needs of pain patients. So those are my two top ones, education and then bringing mental health closer into pain care on the bio side. So we're kind of all working together.
I love those. Yeah, we have the same problem in Canada. It's not a privilege of the United States. Yeah, we do have the education for family physicians during residency here in Canada is very minimal about pain. And when they learn about pain, it's mostly acute pain. They don't learn much about chronic pain. But interesting, veterinarians here in Canada get a lot of training, much more than physicians get. But I guess the animals, they don't have the psychosocial, so that would be easy for them to teach. But you are right. I would say the mental health aspect is scary. It's scary to us doctors because if you open that box, as you said, you may hear a lot of things that you're not prepared to respond and you don't have the resource. And I find that my colleagues who, when they see mental health problems, the first thing that they think is, here's a prescription. Here's a prescription for your depression. Here's a prescription for your anxiety. Here's a prescription for your sleep. Here's a prescription to calm you down. So they think about drugs. I'm not against those medications. I use those, but I think most of the time, having a counselor, a psychotherapist, a psychologist, someone that can hear you and give you evidence-based counseling information is all you need, because you do need to have that valve of escape with all of those frustrations, emotions that are going on. And I find here in Canada too, and I think in other parts of the world, the mental health, especially around pain, because not just mental health in general, maybe you can access a mental health provider who will help you with your depression, but they don't know the connection between depression and chronic pain. Like chronic pain seems to be a taboo that the psychologists, social workers, they may not want to talk about because they don't know what it is. But then the patients feel alone. They feel isolated. I have no one to talk. I have, at work, it's a problem because they hide at work that they are in pain. They pretend they are okay. They are doing okay. And then they come home and they crash because they don't have more energy and to do anything else. So that's why I wrote my second book. The second book, You Are Unique and So Is Your Pain, is for patients with chronic pain to use this as a diary. You don't need to use my book. If you're hearing this video, you don't need to use my book. Just get a blank page. And if you don't have anyone that you can talk to, just start, putting your thoughts on a paper, and then, put the paper away and or delete the file if you use a computer. But you need to have that valve that you can know better what's going on in your mind and your emotions and your relationships. And talking about relationships, Mara, would you talk about how relationships, because there's a social aspect of pain, how does that affect pain? Like in a relationship, in a spouse marital situation, or at work, or with kids, or with family, or with the healthcare providers. What is your advice for someone who is having pain, chronic pain, is having issues in that area, and maybe they don't see the connection between how those things affect their pain? What would you tell a person? If you can talk to one person here who is watching this video right now, what would you say to that person?
Wow. Well, I feel honored to get to answer that question. I would say that, when I think about me and my spouse, who we've been married almost 20 years now, and I'm actually writing a book, and it's called My Chronic Pain Marriage. And it's about how I really see my relationship with pain as somewhat of a marriage because of the push and pull and the challenges, but also the opportunities to overcome and to coexist. And I talk about how sometimes it feels like my pain is the third person in my marriage, and the challenges associated with navigating that. And I guess I would say, as far as how to navigate relationships, whether it be professional or personal, with pain, it's if you don't take care of yourself first and recognize your own needs and address those needs, it's very hard to be in relationships in a way that feels good to you and good to those that you care for. And that I kind of had to hit rock bottom with that. I mean, I become very isolated from my kids and my husband in some ways, a lot of time in bed, being sad, isolating from relationships. And when I started to invest time and energy in my mental health and like what I needed to feel good, I mean, it even included separating from certain relationships that were not serving me. I gained a new agency and control in my life, because when you have chronic pain, you feel like you have no control. You can feel very helpless. And when I started to invest in my own needs, I was able to be more present and engaged with professional colleagues, with my family, with people I care for. And so that's the main message, I think. It's looking inward. And when you talk about the journaling, you prompted something for me which relates to this, which is when I was kind of at the height of this, I was reading a book by Elizabeth Gilbert called Big Magic, and she talks about creativity in life. And I had started writing my book, and I was wanting to like absorb about creativity and ideas. And she has a piece in her book about writing to fear and having fear write back to you. And I took that idea and I wrote to my pain and had my pain write back to me. And I did it in 5 to 10 minutes. And it was really enlightening. I saw on the page all the anger and frustration that I had. And in my book, I do actually publish this writing of to and from, and the tension in the relationship. And that helped me realize, like, I've got a lot of work to do to help me feel good. And that in turn helped me get to a better place in sort of family and relationships and how I show up. It's not perfect. I mean, we all are living, challenging, complex lives, but I feel that the investment in me made all that difference in relationships.
Yeah, and you said a key word here that I'd like to remember. You became in control. You were powerless before. You just let pain control your life and dictate your agenda and tell you when you could go or not go. I see so many people in that situation. And I feel so sorry for them, because sometimes I know they will have this pain for many years to come, maybe for the rest of their lives, or maybe it will be less, but they can't lose that control and just sit back and be a passenger in your life and let the pain drive your car. I tell them it is possible. You can go and sit in the driver's seat and control your life and tell your pain, stay in the background. I'm doing this. This is important to me. You go to the back seat. I know you are here. I'm not telling people to ignore the pain and be stoic and, go through the pain and be strong. That's not what I'm saying. Acknowledge the pain. Say, I know you're here, I know you're intense, but I'm going to live my life and I'm going to go back to school. I'm going to go back to work. I'm going to raise my kids. I will get pregnant. I had a patient a couple of weeks ago. She's feeling a different person now. She got pregnant because for many years she was postponing because of the pain. So those are the things that bring me joy to my life, to my work. And I'd like to thank you so much for coming here today and share your story with us. And I'd like to finish asking you, where can people find you, your books? And I'll also put those books that you mentioned today. I will put in the description of this video below so people can read them if they want. But where they can find you, Mara, what you wrote and on social media, just tell here. But I'll also put this in the description of this video below.
That's great. Thank you. And on the book front, I have a manuscript that is not yet published. So I'm in pursuit of a publisher. And so the book is TBD when that will become accessible. Happy to share when I know more on that.
Yes.
As far as where else to find me, I do write on Substack, and my Substack is called Chronic Pain Chats. And I also have an Instagram, same name, Chronic Pain Chats, that people can find information. I write about my experience and also the environment in which people are living and experience chronic pain. And I try to unpack the research around the biopsychosocial nature of pain in these writings and in my Instagram in a digestible way, because it can get complicated really fast. And I've spent a career in healthcare policy unpacking really complex healthcare policy into digestible information. And so that's sort of the goal on unpacking the research in ways that people can access in a meaningful way. So I appreciate that. And I'm so appreciative of you inviting me to come and talk and share my experience and how I'm looking at, this space, which is so important to so many people.
Yes, thank you so much for coming here today. And I'd just like to end saying that this video, neither me or Mara, we are here to give you medical advice, to tell you what to do. This is just for your education. This video is just for you to learn more about maybe what you can do for yourself, but also to help the healthcare system wherever you live. And please remember, if you are not feeling well during this video, turn it off and go to the nearest emergency department or call an ambulance. And we would appreciate it if you give a like to this video and write your comment below. In the comment section here, you can leave a comment. Mara can come here and answer some questions that you have, or anything that you saw that you agree or disagree, or comments. What would you like to see in your own country? We have an international audience here. So what would you like to see changed in your own country, in your healthcare system? Tell us where you are watching from and what are the things that you think needs to be changed to improve the lives of people with chronic pain. Thank you so much for watching today, and don't forget to subscribe to this channel too. Okay, bye.
Thank you.